Morning, everyone. My name's Seth DuCharme. I'm the acting United States Attorney for the Eastern District of New York. Today I'm joined with some of our closest law enforcement partners here. With me are District Attorney Tim Sinney, Homeland Security Investigations Assistant Special Agent in Charge Chris Lau, Suffolk County Police Commissioner Geraldine Hart, and I'm also joined by Nicole Bachman, who's the chief of our Long Island office for the U.S. Attorney's Office. You're going to hear from each of our partners today because all of us worked very closely on this case together, and everyone played a critical role. And it's good to be outside today. Hopefully we can avoid the COVID and continue our critical mission, which includes informing the public about important developments in some of our law enforcement efforts. As you know, protecting the integrity of our healthcare system and our immigration system are among the highest priorities for the Justice Department, as well as our local partners. And today's case really relates to an attempt to pervert those systems, both the healthcare system and the immigration system, to criminal advantage and for improper reasons. Today we are announcing that prosecutors from my office, along with our partners, have taken down an international fraud scheme that was responsible for unlawfully bringing pregnant women from Turkey here to Long Island to give birth, to provide birthright citizenship for those babies. And while they were here, they engaged in acts of fraud which improperly diverted Medicaid funds to care for the women and the children while they were in birth houses that were set up around Long Island in what's come to be known, at least in some circles, as a birth tourism scheme. Now, I really want to make clear that the United States has welcomed immigrants to this country and to the Eastern District of New York since our country was founded, and that's something we encourage. We cherish U.S. citizenship. Anyone who's ever seen a citizenship swearing-in ceremony knows how moving that is. So we want to make sure that people understand. We welcome immigration when it's correctly done, and we respect and cherish U.S. citizenship. But this case was really about twisting those motives and incentives for people who wanted essentially the luxury of having a baby born in the United States and the birthright citizenship that comes with it, without going through the proper channels and along the way, lying to the United States government and others to perpetrate their scheme. So this morning, based on evidence that we collectively uncovered during a long-term investigation, a federal indictment was unsealed, charging 4 Turkish nationals and 2 United States citizens with carrying out this healthcare fraud and money laundering scheme for approximately 3 years, from January 2017 to September 2020. Please remember that the charges in the indictment are not themselves proof of anything. They're mere allegations, and the burden remains on us to prove each of those charges, which we expect to do. We've alleged that between 2017 and 2020, the defendants fraudulently facilitated the births in the United States of approximately 119 Turkish children. And those children now hold birthright U.S. citizenship and the accompanying rights and privileges of a United States citizen. We've further alleged in the indictment that the defendants used social media like Facebook to advertise pretty brazenly their scheme, and I think we have some demonstratives that show that. But the ads essentially said, if you want your baby born in the U.S., pay us some money and we'll get it done. The fees ranged from $7,500 to $10,000. And the advertisement, promised women that not only would they have the benefit of birthright citizenship, but they'd have insurance coverage to pay for their medical expenses. These birth houses that were set up around Long Island, there were 7. At various times, they were located in Center Mauritius, Dix Hills, East Northport, East Patchogue, Smithtown, and West Babylon. The Medicaid fraud aspect of the case involved false statements to Medicaid that these Turkish nationals were represented to be residents of New York State who had no income, which was in fact not true. Many of them were people of substantial means, and that they resided here on Long Island in these birthhouses, which they didn't, and that's fraud, plain and simple. And I think what makes it especially disturbing is that it was really premised on a desire to shortcut the integrity of our immigration and healthcare systems to get these benefits. The desire to have your child born in the United States is understandable, but the methods and means employed by these criminals were both unlawful, completely unacceptable. The rule of law must be upheld, no matter how enticing the notion advanced by these criminals may have been. So in connection with the scheme, we've charged the following defendants: Ibrahim Aksakal, Enes Burak Kakaroglu. Sure. Can I go with just the last names? And then I'll give them to you afterwards. How's that? We've got them written down. So Aksakal is Aksakal. Kakaroglu is Kakiroglu. Sarah Kaplan, Kaplan. Marta, Marte, and Rodriguez, common spelling. And be happy to have John give you the spellings of the complete names. So Aksaku, Kakaroglu, and Kaplan, they were largely responsible for advertising the scheme, and Marte and Rodriguez allegedly assisted the women, the foreign nationals, in applying for Medicaid coverage and assisted in submitting the fraudulent applications. All 6 defendants were charged with conspiracy to commit healthcare fraud and wire fraud and money laundering conspiracy. 4 were charged with conspiracy to defraud the United States, visa fraud, unlawfully bringing in aliens, and 2 counts of money laundering. We've been able to identify about $750,000, mainly in cash, that the defendants brought in, and the fraudulent losses to the Medicaid program look to be about $2.1 million. Some of the illegal cash proceeds made their way to bank accounts in Turkey, and we're continuing to work on tracing the other funds. So over the last 24 hours, agents and officers from Homeland Security Investigations, the Suffolk County Police Department, United States Department of Health and Human Services, New York State Department of Health, the Office of Medicaid Inspector General, all work together to arrest defendants at various locations here in Suffolk County. The defendants will be arraigned this afternoon before Magistrate Judge Stephen Locke. Search warrants were executed in connection with the investigation, which continues. And my office and our partners are working diligently to pursue this investigation, beyond these defendants, wherever it takes us, to protect our communities and our resources, which are frankly limited, and the integrity of our system, our immigration system and our healthcare system, to make sure that all people are treated fairly under the laws, and all of our people enjoy the same opportunities when they avail themselves of those opportunities consistent with the law. Finally, I want to thank the Assistant United States Attorneys from my office who worked on the case, Brad King and Oren Gleich from our Long Island office, and Special Assistant United States Attorney Jeremy Glicksman and Joseph Connolly from the Suffolk and Queens County District Attorney's Office, respectively, for their outstanding work. I'd like to thank our partner agencies, which also include here the U.S. Department of State, Health and Human Services, Customs and Border Protection, New York State Office of the Medicaid Inspector General, and the New York State Department of Health. Remind you that, of course, charges are mere allegations. These defendants will have their day in court starting this afternoon. We look forward to that. And now it's my pleasure to turn over the microphones to my friend and colleague, Suffolk County District Attorney Tim Sinney. Thank you very much.
Thank you very much, Seth. Let me start off by just thanking all the partners that stand before you, particularly the United States U.S. Attorney's Office for the Eastern District of New York, both Seth as well as the head of the Long Island office, Nicole Bachman. What's interesting about this partnership is we have very much of a philosophy, regardless of who's running with the investigation or who's running with the prosecution or where the case starts, we need to bring cases where it makes the most sense. So if it makes the most sense to file a case in state court, or it makes the most sense to file a case in federal court, that's what we're going to do. And you've seen that on a number of different fronts. You've seen that on the drug front, the gang front, and now you see this very interesting, unique case, this collaboration. And the way we do it oftentimes is through the designation of assistant district attorneys as special assistant United States attorneys. And I'm very grateful to the Eastern District of New York. We actually have approximately a dozen ADAs in my office who are cross-designated as federal prosecutors, 11 of whom are in the Eastern District of New York. And that just really strengthens that partnership between the two offices. And then that, coupled with our strong partnerships, both between the U.S. Attorney's Office and my office, with our federal law enforcement agencies and the Suffolk County Police Department and other state and local agencies, you really have law enforcement operating on all four cylinders, and that's really great to see. I just want to thank everyone for their partnership. Now, this is an extraordinary case, and you have folks who are immigrating, coming here illegally, defrauding the immigration system by obtaining tourism visas when in fact they're coming here to give birth so that they can get citizenship for their babies. They're doing it on the backs of the taxpayers. They're milking the Medicaid system. So it's a real combination of immigration fraud and healthcare fraud that Suffolk County residents in the end would have had to pay for if it weren't for the great work of the team you see here. Now, I want to just reiterate Seth's comments. Immigration is the backbone of this country. But in Suffolk County, law enforcement will not tolerate illegal immigration on the backs of Suffolk County residents. It will not happen. And I want to thank everyone here who did such an extraordinary job in this investigation. It was a complex investigation. It was international in scope. It utilized a number of innovative investigative techniques, including wiretaps, and a lot of work went into this from a lot of different agencies, and I want to thank everyone for their partnership. And speaking of partnerships, I want to invite my colleague Chris Lau from the Department of Homeland Security. They did a phenomenal job on this case, as they often do on cases involving trafficking, immigration, fraud, and I very much appreciate their partnership.
Good morning, everyone. So good morning. My name is Chris Lau. I am the Assistant Special Agent in charge for Homeland Security Investigations, New York Field Office, based here for the Long Island Division. First and foremost, I want to say thank you to District Attorney Sini for hosting this event, and for our law enforcement partners here, including Acting United States Attorney Seth DuCharme. Thank you. For the Police Commissioner of Suffolk County, Geraldine Hart. It's a great partnership that we have out here. We're here this morning to talk about birth tourism. It's a topic that not only strikes a personal chord with me as a father, but also on a professional level as an HSI special agent, because it touches on so many of the health, safety, and national securities where we at HSI are charged to safeguard, including dismantling transnational criminal organizations, exploiting our most vulnerable population for profit. These criminal organizations are stealing funds from an already exhausted healthcare system, which requires all of our resources, more than ever right now, to serve our communities to combat COVID-19 and other critical needs. The problem associated with birth tourism is growing steadily, as it is estimated that over 30,000 childbirths occurred in the United States last year alone in connection with this practice. The scope of birth tourism cannot and should not be ignored. It criminally manipulates our visa and immigration systems, potentially making it harder for legitimate visa holders and immigration petitioners to enter the United States and remain here. It drains our state, local, and federal public assistance programs, costing taxpayers millions of dollars each year, monies that could go to other needy families. It exposes America to the use of birth tourism pathways by our opponents who seek to procure and provide immigration benefits to national security threats. And most importantly, it has been historically shown to place pregnant women and newborn babies in locations that are unsafe, with potentially unlicensed healthcare providers in an unregulated environment where proper medical attention for mothers and their babies might not be immediately available. All for the profit of selfish individuals who see dollar signs instead of children. In this case, working with our partners, we discovered a Turkish birth tourism organization operating multiple birthing houses here on Long Island in the county of Suffolk. Our joint investigation revealed that members of this organization recruited pregnant women and their families to enter the United States by fraudulent means and receive publicly funded prenatal, birth, postnatal care for their children, who ultimately derived United States citizenship. Our investigation did not stop on Long Island. Working with our HSI representatives in Turkey, we conducted undercover operations with Turkish law enforcement and were able to ascertain that the organization charged approximately $7,500 per traveler to come to the United States. To date, we've identified over 100 individuals who collaborated with this criminal organization, resulting in millions of dollars of public assistance, fraud, and countless visas and immigration benefits that should have never been issued. The investigation has not ended with these arrests. We continue to look into every aspect of the organization's personnel, resources, and actions, both within America and around the world. Together with our law enforcement partners, we will identify, eradicate these structures that supply and enrich these criminal organizations, both here and abroad. I want to thank our partners standing here with me today, especially the Department of Health and Human Services, Office of Inspector General, Special Agent in Charge Scott Lambert, whose team was invaluable to this investigation. HSI will not stand by idly to watch our most at-risk and innocent treated as a revenue-generating resource. These criminal organizations pose a threat to our American way of life, and we will ensure that the world's most vulnerable, our children, are not exploited and left helpless for some profit scheme. And with that, I'd like to turn this over to Commissioner Hart. Thank you.
Thanks, Chris. Good afternoon, everybody. Thank you for joining us. I want to begin by, of course, thanking all of our partners that you see here today, the Eastern District of New York, our District Attorney, Tim Sini, and our partners with HSI. This is the first time that the Suffolk County Police Department has handled a birth tourism case, and I would like to commend the efforts of our criminal intelligence detectives who began working on this in July of 2018. It started when information was provided to detectives about birth certificates obtained by 5 Turkish women, all with the same address, who had babies around the same time. At first, it was not clear if there was any criminality involved, but thanks to the tenacity and the hard work of our detectives and our partners and the countless hours that they put in, a case came together and unveiled a birth tourism ring that involved women from Turkey arriving in Suffolk County to give birth in order for their child to gain birthright citizenship. As detectives began investigating, they developed information about who was involved, their locations and occupations, and within 6 months, the list of 5 babies grew quickly to 19. I want to speak about Detective John O'Grady and James Fawnin, who were the detectives in our criminal intelligence section, who really did the work back in 2018 to understand what they had in front of them. They're tasked with a lot of different duties, our detectives, in the intelligence division, including counterterrorism, gang intelligence. So for them to really kind of just drill down on this and see what they had, and I can tell you from experience, My first assignment coming out of Quantico was healthcare fraud, and these cases are really, really difficult to make. They're very complex, and they just don't happen without these partnerships that you see before you today. So I really just want to commend the work that they did. I want to talk about kind of the impact that this has. We know that violent crime and property crime in Suffolk County is at its lowest levels in the history of the county. So thankfully, many residents will not be impacted by those type of crimes, but this impacts everybody. So it's really the dedication of the detectives and the investigators and the commitment of those that you see behind me to make sure that we're doing these type of cases that have such a broad impact. So really, just thank you to everybody, and thank you all for covering this.
Where do the women stand as of now? Are they going to be allowed to stay here? I'm sure the children are going to be allowed, but how is that being handled?
Well, we're providing information to the State Department, so immigration determinations, can be made in the normal way. We're not looking at the women as targets of the criminal investigation.
Sir, what typically happens? How much time in total would these women spend in the country? And then at the end, after they give birth, do they then go home, back to Turkey with their child, or do they try to stay here?
Yeah, the amount of time, it's my understanding the amount of time that they spent, not surprisingly, here on Long Island varied depending on the circumstances of the woman. Many of them did return to Turkey with the children.
What about the children? Do they maintain their birth citizenship?
I'm sorry, I've got two. Maybe it's the same question from two directions. What was your question?
The children, will they maintain their U.S. citizenship?
Most likely they will. Under our current system, it would be unlikely, I think, for the children to lose their U.S. citizenship. Though not impossible, but I think it's unlikely. I believe that's right, but I can confirm that for you afterwards. Yeah, I'll have to get back to you. I'm not sure, frankly, where they were from.
Yeah, so it was really Smithtown, which is where it began, and just really kind of the alert employee of the town who brought this forward. So they really deserve a lot of credit as well. I believe so, yeah. Yeah, I think so.
Yeah.
My understanding was that they would rent the homes, and then within the homes they would rent different rooms to some of these different families that came over.
Will you be providing the locations of those birth houses? The exact locations?
I would say,
Yeah,
part of the ongoing investigation.
yeah, I think it's part of the ongoing investigation.
Will you be providing that to the request?
I'll see if it doesn't interfere, certainly.
Can you tell us anything about the conditions inside those homes? Were they, comfortable conditions as advertised,
Right.
or something different?
Right. Yeah, sorry. I'm not certain on that. I do know that these women were assigned a room within the home. I don't know specifically the conditions of the house.